Hi everyone. I am so glad I'm here and I can actually make this happen because I myself had so many questions and so many things that I want to ask Dr. Tedros and Maria. This is a really scary time. So first and foremost, how are all of you? Are you feeling okay? Are you feeling safe? I know that I'm feeling a sense of fear combined with a sense of uncertainty, and I think all of us are in the same boat. And I want to really thank the unsung heroes out there, the people, healthcare professionals, people who are actually on the front lines, pharmacies, grocery stores, delivery, neighbors who are being kind to neighbors, law enforcement, banks, government programs. I mean, some of us have the ability to stay at home, and that is our contribution to this pandemic because that's the only way we can flatten the curve. But there are some people out there who don't have the choice because they have to be on the front lines to help the rest of us, and it's their jobs. And I really just want to take a second to say thank you to all of you out there who are taking their responsibilities so seriously. Second of all, I want to share, sort of good news that China has reported no new infections in the last couple of days for the first time in months, which is, I guess, a little bit of a silver lining in a terrible time. Global Citizen, I've partnered with Global Citizen right now to be able to get you this information directly from the experts that are actually dealing with this in a big way. When I first started to hear about COVID-19, the coronavirus, I was at the World Economic Forum in Davos, and I was urging governments and the world's biggest corporations to support the advocacy group Global Citizen and my partner and their campaigns to support the Sustainable Development Goals. And just a few weeks later, the world has literally been turned upside down. There's so much misinformation, and that is what scares me, is the misinformation around the coronavirus and what we're dealing with. Is there's so much out there that I thought it would be a really good thing to get information for all of us. So I've partnered with Global Citizen again to break down some of these mistruths. Two of the most qualified people in the world to address this is Dr. Tedros and Dr. Maria van Kerkhove from the World Health Organization. And as we talk today, I want all of you to visit globalcitizen.org /coronavirus, where you can get all the information that we all will be discussing. You can take action. You can find ways to support the WHO and their response campaigns. I've taken a bunch of questions from over the last week from a lot of you, and I'm going to be bringing them up with Dr. Tedros right now. Should we connect them? Let's connect Dr. Tedros and Dr. Maria. I hope you're all doing good. Yeah, we got it. We're just waiting for them to come on. But in the meanwhile, thank you all for sending such interesting questions. Hi, Dr. Tedros. How are you?
Hi.
Maria, how are you?
Hi.
Thank you so much for taking the time for doing this with me.
Thanks for having us.
Thank you for having us.
Of course, it's such a scary time that I think that, having some time with you guys makes the most sense for all of us to get some information. Just a couple of questions quickly to you, Dr. Tedros. I know you have to head out soon because you're dealing with one of the worst pandemics we've seen. One question directly to you is, do you think that the countries are doing enough to protect their citizens?
Yeah. Thank you, Priyanka. This is a great opportunity for us. And I remember when we met for the first time in Davos,
yes,
at the World Economic Forum, through our friend Hugh Evans,
yes,
the CEO of Global Citizens. So it was really great meeting you there in person and now virtually.
Thank you so much.
We're really proud of what you're doing, and thank you so much.
Of course, anything I can do, sir.
Thank you. And you said scary times, and of course, very, unprecedented challenge. But I also believe that with strength, courage, and unity, we can overcome it. I think this challenge can bring the best of us. And if you remember in Davos, that's what we said. And we were together in that evening, and we said, yes. I think solidarity, unity, strength, and courage will really overcome this challenge.
So, Dr. Tedros, are you seeing enough solidarity, you feel, in the world right now?
So, from countries, we see now more and more action. One thing we have been asking for is political commitment, strong political leadership, whole of government approach, whole of society approach. Mm-hmm. And many countries are already delivering that. The highest leader in many countries, the head of state or head of government, is leading the response, which is very important, because this pandemic cannot be addressed by just one sector or the health sector. It needs all government sectors to be involved, the civil society to be involved,
absolutely,
the private sector to be involved, and not only that, the whole society to be involved. This response should be owned not only by the government, private sector, but by the citizens also. This is everybody's business. And we're seeing positive developments, but there are still gaps, and we have to do more.
So if I may ask you a question, just because I want to get into a few specifics from you directly, what are the top things that you think people like us, like, people around the world can do for now to protect, as individuals, to protect themselves and their families? Is social distancing, staying away from anyone, right?
Yes. By the way, social distancing is one of the tactics, but many people are not comfortable with that phrase, and we can call it physical distancing.
Okay.
Because even when we're physically a bit distanced, we have to be together socially. We have to be together in spirit. So the physical distancing is one. And there are, many measures that are being taken by governments, like banning meetings, big gatherings, and other physical distancing, like closing schools or other actions that are being taken.
Yes, but India just implemented a 21-day lockdown in a country full of 1.3 billion people. So there are a few governments that are taking it seriously, clearly. But do you think that, around the world, because you deal with almost every country, do you think around the world countries are doing enough, like governments are doing enough?
These are important measures, but it's not enough. Mm-hmm. And WHO is saying physical distancing and the other measures you said are important, but at the same time, we have to test cases, that's suspected cases, and we have to isolate cases, and we have to trace contacts and isolate them too. And we need to have a comprehensive approach. So I said it yesterday in my press conference, physical distancing or social distancing is a defensive position or defensive tactic.
Right.
But we need into testing and isolating, quarantine, and so on in order to be on the offensive. That's how we can suppress the virus. That's how we can.
So Dr. Tedros, you say we should get tested, but there are so many countries in the world that don't have enough tests. What should they do?
There are many countries who can provide testing, but who are not testing enough. And even high-income countries. So they should make sure that there is access to testing. because I don't think they will have economic reasons not to do it.
All right. So then
there are countries who are low income or middle income who may not afford it, and we need to have international solidarity to support them. And
we need high income countries to be able to help the low income countries.
Exactly.
Are you worried about
That's
these
why
low income?
solidarity should come.
Yes. Are you worried
That's
about
where
these low income
solidarity.
countries, which without many cases, because they're not being able to get tested, so we're not seeing those cases? Do you think that's what is happening?
You
In a
know,
lot of low income countries around the world.
WHO was warning the whole world. I will tell you, when
Yes.
we declared the public health emergency of international concern, while we had more than 11,000 cases in China, we had only 83 cases in the rest of the world.
Wow.
83 cases in the rest of the world means this could have been tested, contacts identified, isolated, and the problem could have been cut from the bud. And if you remember, we have been saying there is a window of opportunity because most of the cases are in China. The number of cases in the rest of the world is very small. So let's cut it from the bud. But I think there was a problem in the listening of the rest of the world. And that's why the number of cases started to increase. And now, as we speak, we have close to 400,000 cases. And this is 90,000 cases in China versus more than 300,000 in the rest of the world.
Wow.
So it just shifted.
Yeah.
So imagine when we declared emergency by WHO, it was 11,000 in China versus 83.
And it became the opposite
in the rest of the world. Now it's upside down. And we have been saying the window of opportunity, there is a window of opportunity, let's act. And then when action was not really forthcoming, we said the window of opportunity is closing. It's closing, it's narrowing. Take action. And the action is the comprehensive approach.
What can we do to flatten this curve now that, you know, people didn't listen to the WHO when you warned them? And what is it that urgently we as countries can do, we as people can do, the civil sector? Like, what can we do now that this has become what it has?
The same. It's a comprehensive approach. We do the physical distancing, the social distancing, which you said. I don't want to call it social distancing, but physical distancing. But at the same time, testing, tracing contacts, isolating, and a full package. We have to be on the offensive. I brought yesterday the metaphor of soccer game. You cannot win a game if you're on a defensive position. You have to be on the offensive to win. This virus should also be attacked. We cannot win by defending. And we have seen many positive stories here. South Korea is doing the same thing. I can tell you, in mid-February, South Korea was reporting close to 1,000 cases per day.
Right.
Now, yesterday it reported only 64 cases per day. It followed exactly the same comprehensive strategy. Go on the attack. Singapore, the same thing. Japan, the same thing. China, the same thing.
A lot of countries,
the rest of the world,
right,
to do exactly the same, to be on the offensive, to implement the comprehensive package. But I would like to invite my colleague, an amazing expert, Dr. Maria Van Kerkhoff, to...
It's a tough one. It's a tough name.
I got it now.
to say more. She's more expert than me. I'm the boss, but she is the expert and a very fine expert.
No, I don't know about that. But I think, you know, one of the things that is really interesting to me is I'm an epidemiologist, and my life is this type of work. And we think about these types of scenarios all the time. I work on a team that deals with emerging infections, and Dr. Tedros knows all about this. with his
Right.
experience. We plan for these types of things and we prepare for these types of things. And we work through these scenarios that you may have these little events. And most of the time, there are events that happen and you have small clusters of cases, and then there's a big outbreak investigation and they go away. In
Right.
this situation, it had a chance to take off. And it took off in China, and we saw this incredible response from China. And what that response included is what Dr. Tedros just said. It was this fundamental aggressive action, the offense, to find these cases. And to find cases, you have to look. And to find
And you
cases,
have to test.
And you have to test.
So there are so many, and I really wanted to bring this up with you. There are countries that are saying that it's going to economically affect, you know, a lot of countries if we have to create a sort of quarantine, or if we stop people from going to work. What do you have to say about that?
What I have to say is that this is temporary. We are going to get through this. You mentioned before, we were listening to you before we joined you, you said people are scared. That's normal. You know, having fear around this is nothing about this new world that we're living in right now is normal, but people are showing solidarity. They're showing ways to turn that fear and that scared into something positive. And while doing your part, you ask, what is your part? Every single person on the planet has a role to play here. Every single person is part of this fight. And if you don't know what that is, you need to find out. That's why we're here. You know, we're here to say what your role is in a couple of things, right? You wash your hands. You know, it's basic, it's common. You wash your hands with soap and water. And if you don't have that, you use an alcohol-based rub. You practice your respiratory etiquette. You sneeze into your elbow. Again, really simple, but I'm sure many people across the planet don't do that.
My 3-year-old niece Krishna does it. She sneezes into her elbow now.
Yes, there was a wonderful video of Elmo teaching the world to do this in the 2009 pandemic, which I'll never forget. You do your part and you stay home. If the government is telling you to stay home, stay home. And stay home for the people who can't. Stay home for the healthcare workers who are going in and working on the front lines to care for patients. Other things that you can do is be informed. Be well informed about where this virus is, what your governments are telling you to do. Be compliant. Listen to the government. This is temporary. To go back to your question, this is temporary. So the more that we do now, the more aggressive we are now in these approaches and adhering to these measures, the quicker we're going to get out of this.
The quicker we can contain it. Well, just keeping that in mind, I had asked a lot of people to send in questions, and I would love to address a few of them. The first one is from my husband, who's here. I would love to introduce both of you to him. This way. This is Nick. That's Dr. Tedros and
Hello.
Dr. Maria.
Hello.
How are you?
Hi, Nick.
Sorry
How are
to
you?
cut your live stream here.
Yes.
Doing well. We're staying inside. We've been kind of locked down for 2.5, 3 weeks almost now. But I'll make my question quick. I'm a type 1 diabetic. She's asthmatic, and for both of us, I think we were concerned and had some fears early on about just being exposed and what the effects would be for us. So for other type 1 diabetics or diabetics type 2 as well, or people that have asthma or any other
Or are immunocompromised.
What extra precautions should they take? And for me, what should I do to be just conscious of the effects that COVID-19 might have?
Yeah. You want to start? Please. So what we know from cases that have been occurring across the globe is that there are certain people who are more at risk for developing severe disease. And those are individuals who have diabetes, they're individuals who have cardiovascular disease, have chronic respiratory disease, have cancer. And so these are people, and people of advanced age, so people who are over the age of 60. So we need to ensure that you can limit your exposure, your potential exposure to this virus as much as you can. So taking the measures that you just said of staying home for a couple of weeks is a good one. But we need other people who don't have those chronic conditions and who are younger to also help you, because every single person who prevents themselves from getting infected prevents somebody else who could potentially be in a vulnerable category from getting infected. And I think if the one message we could get across to young people across the globe is that, as Dr. Tedros has said, you are not invincible. And we have seen that there are people with underlying conditions who are more at risk for severe disease and for dying, but we also see young people too, admitted to ICU. So it isn't just for the old people, isn't just a disease that will kill people who have underlying conditions. Everybody is at risk. It's a new disease. So you taking extra precautions to prevent yourself from being exposed is good. And if you are out, make sure you do the same. You do the five, which is this campaign that we just launched with FIFA. You wash your hands. Hands is the first one.
Okay. 20 seconds, wash your hands, take the time to do it.
The elbow.
Sneeze or cough into the elbow.
Don't touch your face. Everyone touches their face. Don't
and
touch
then
your
the distance.
The distance.
And the feeling. Check how you're feeling.
That's right.
If you have problems, you know, temperature, fever, and so on, then
stay home.
Stay home.
Stay home. And really,
5.
That's right. Those are the 5 things you need to do. If you have any trouble breathing, if you get sick very, very quickly, call your doctor immediately and go seek healthcare. But always make that phone call first so that they can expect you coming in.
Great. Thank you so much.
Yeah,
thank you. For the question.
Thank you.
Thanks,
Thank
babe.
you. Very nice to see you.
I have a few more. There's a question from Amelia Surtes. Can you catch the virus from the air? Is it airborne?
The virus is not airborne.
Okay.
So the virus is spread by what we call droplet, which is basically little particles of liquid that come out of your nose and your mouth when you talk or sneeze or cough, which is why you have to do this. And those particles need to reach somebody's eyes, nose, and mouth. And so
that's the only way you can contract it. So guys,
right.
That is something just that you guys need to know, that please don't be afraid. There's a very specific way in which this virus can be transmitted, and it's not through air, it's not through food, it's not through animals, right?
It's not through food, it's not through animals. But the other thing I want to mention is that it could be through contact, fomites we call, which is basically when those particles get on a surface, like a hard surface like this, if you touch it and the virus is there, and then you touch your eyes or your nose or your mouth, you can get infected that way. So
if someone coughs into their hand and touches the table, and you touch the table and touch your eye, you can get it.
But that's a barrier. It doesn't mean because you touch the table, you're infected. You still have to touch your eyes. So if you wash your hands, use the alcohol rub, you kill the virus. The virus is gone.
That is a great question. Another question I have from @Divya_Jyoti. If you have recovered from Corona, can I get it again?
We get this question a lot. So we don't have the full picture of this virus because we're still only 12
We're all learning.
We're all learning. But if I can mention, we know that more than 100,000 people out of those 400,000 cases have recovered. And that's also important to be part of the message. It is still scary, but people are recovering from this. And what we are expecting is for people who do get infected, that they will develop some kind of an immune response. We don't know how strong that is yet. We don't know how long that will last. So we're working with a number of countries to try to collect that data more systematically so that we can give a proper answer to that question.
That's great. Another question, is COVID-19 vulnerable to heat? And if our house is warm, will the bacteria die? Mr. Nankis asks this question.
So first of all, thanks for that question, because we do get lots of questions around temperature and what that actually means. This is a virus, so it's not a bacteria. So it's a different kind of pathogen. The virus can spread in different temperatures. We've seen it spread in cold temperatures in northern China. We've seen it spread in warmer temperature in Africa and in Singapore and in other places. There is some question about what may happen when the summertime comes in the northern hemisphere, and then the winter starts in the southern hemisphere, excuse me. And it's not necessarily a change in how the virus behaves, but we behave differently in the warmer weather. You know, we spend a lot more time outdoors, indoors. So again, only 12 weeks in, so we're still trying to understand how this virus behaves, but there's, I don't know, hundreds of thousands of people that are looking at these types of questions, and we are working with as many of them across the globe as we possibly can to try to put that evidence together to help us better have an even stronger response.
Well, thank you so much for clarifying that. Another question which I have is is there a vaccine? Finding a vaccine will be crucial to a long-term solution to corona, obviously. Are you guys working with Gavi, the Vaccine Alliance, and others to produce a vaccine to ensure that everyone has access to it?
Are you starting
Yeah.
that one?
Yes, we have started that some weeks ago, more than 8 weeks ago, actually. We have convened a meeting of more than 400 scientists, and there are some vaccine candidates now, and we're working on those through those scientists throughout the world. But the thing here is vaccines may not be ready between 12 months from now.
Wow,
So
it'll
it
take
may
a year, you think?
Yes, a year to 18 months, a year and a half. That's very
Wow.
good. You're using your elbow. So 12, so a year from 12 months to 18 months, it may take.
Oh, wow.
But it's a very important investment, and we're working with Gavi, we're working with CEPI, we're working with other institutions and convening that platform in order to speed up the discovery of vaccine, but it takes time. So the idea is to do everything we can now, public health measures, to suppress and control the disease, but at the best in strategic issues like vaccines.
Got it. Wow, it'll take a year. Is it possible to have COVID-19 and not have a fever? This is asked by Jen Lilly.
It is. It would be rare though. So what we know for most people who have COVID-19 is that they have a fever, they have a dry cough, they have shortness of breath. It becomes difficult to breathe. And they may have some other symptoms like muscle pain. They may have a headache. Very few people will have a runny nose and sneeze and like you may see for the common cold or with the flu. But most people, about 90% of people in China, where we have huge case numbers, have reported fever. Yeah.
Wow. So if someone has a cold, it could also be a common flu.
It can. This is the really difficult thing about
this is the gray area, isn't it?
Is that you don't know what you have, but there are some distinguishing features. This fever, dry cough, shortness of breath. That is COVID-19 and you need to get tested. And so the only way we can actually distinguish between each of these respiratory diseases is through testing. So it is important that that does happen, and it's important that we increase capacity across the globe. Technology,
and we provide tests and we find tests for people who can't get it. Another question for you, Dr. Maria, what is co-infection? Can you get two viruses together?
Yeah, co-infection means you're infected with multiple things at the same time. So some people can have influenza and COVID-19. Some people can have like a bacterial infection, like bacterial pneumonia and COVID-19. But yeah, that's what that means when you have the word co-infection.
Got it. I'm just going to take 5 more minutes of your time, just ask a few more questions because they're just interesting. What surface does the virus live on? This is asked by @MarySkelly.
So the virus itself doesn't live outside of the body unless you have a sick person that will cough or sneeze on.
How long will that last if someone sneezes or something?
So on hard surfaces, it depends on the type of surface. If it's like steel, so a lot of these studies are done in hospitals because they look at steel surfaces and plastics and things like that. So there's some early studies on this virus, on the COVID-19 virus, that suggest that the virus can last for hours on hard surfaces.
Wow.
So that's why it's important that no matter what you touch, you wash your hands and then you clean surfaces. That you're using your common disinfectants in your house. You clean doorknobs, you clean tables, and that will kill the virus.
And hand washing is more efficient than just sanitizing your hands.
So whatever you have access to. So some people have access to soap and water and some people don't. And so if you have access to an alcohol-based rub, make sure you do that. And there's a proper way to do this for 20 seconds or 40 seconds. I should know this. Or you wash your hands properly, sorry. But yes, you can kill, that's the point, is that there's a natural barrier that you have. And to wash your hands and to use that alcohol-based rub, even if you touch an infected surface, you can kill that virus.
And thank you for accepting the challenge, by the way.
I did. I have to do my 20-second. I have to find a song. I'm going to do it today. Just another question for low-income countries, because we're talking about water, Africa, India, places where people don't have access to water, soap, or even access to the education around coronavirus. What can governments or countries do so that we don't create a sort of pandemonium or a fear around, the fact that people don't have access and they don't know? What can we do to support people who don't have the access to water and soap?
This is a good question. I'll start. So we have seen really innovative ways in which people have been finding these access to hand washing stations.
Okay.
Where you've seen, I don't know if you've seen pictures of during Ebola outbreaks.
Yes.
Where you've seen jugs and you've seen chlorine with water and different things. And
Yes.
and the human spirit and human ingenuity is really creative. And we've seen through this pandemic, we've seen through other outbreaks before, that people find solutions. And we and you and others, everybody needs to do whatever they can to try to help make those solutions possible. There isn't a one size fits all. There's no one answer here. But we have to do every single thing that we can. And we're seeing some innovative ways where people are getting access to these kinds of jugs and water basins to be able to wash their hands.
That's great. One more question. How do we deal with...
Can I ask you a question?
Yes, of course.
I'm sorry if you don't mind. So my question is, I mean, we've never had this kind of interaction before, but my question is for you in terms of, you have a huge following. I don't know how many millions of people are watching you. You're a role model. And what do you think it is that you could do and your industry can do to help support this pandemic? Because we need everyone we can to help us with this, especially to reach young people.
I think one of the very important things, Dr. Maria, which is something that I'm trying to do, is make people understand that we're all in the same boat, and actually reiterate the 5 things that you said, that this is some sort of weird leveler where it doesn't matter who you are, where you come from, it's going to affect each one of us, and each one needs to be responsible and socially responsible for the other, as countries, as individuals, as people. And I think public people like me, like I'm trying to do that by giving access to my fan base to you guys, and they would not have that access. So that's my way of contributing, and constantly talking about not to have a sense of panic, to be able to make sure that we think about others before we think about ourselves. Stay home, because that's very important, to be able to follow the 5 rules that you do, but to constantly reiterate that to people and create a sense of less, so that panic is not going to solve the situation. Like, people hoarding things and people keeping things for a really long time, when actually healthcare professionals might need gloves and masks and things like that. So I think it's really bringing about education around that, and which is why I'm so grateful that you guys took the time to be able to have this conversation with my fan base. I'm really glad you clarified that it's not airborne, that it's not through animals. That is something that a lot of people were creating. There was a lot of hype around that. I have one really quick question. People are saying
By the way, look, Priyanka.
Yes.
Namaste.
Namaste. I said that a couple of days ago, Dr. Tedros, that old and gold, namaste will come in handy.
Namaste, namaskar. I will tell you one secret, but you started with WEF, so I would like to end it with WEF.
Yes.
The 5 things you said.
Let's do it. The 5 things are: wash your hands for 20 seconds.
WEF
Okay.
and the F. So I'm really sorry, but we're using WEF, the World Economic Forum. The first 3 letters are actually like World Economic Forum, WEF.
So
wash your hands, use your elbow, and don't touch your face.
Face, wash, elbow, face. That's
WEF. Sorry, don't tell them. And then the other 2 are DF, distance. Stay at home or keep your distance, physical distance. And F, the last one, DF, F is, you have to watch your feeling. Are you
Be aware of how
feverish?
you're feeling.
Aware, yes. WEF DF.
WEF DF.
So we started with WEF. That's where we met Priyanka
Yes, we did, Dr.
in
Tedros.
Davos. So the 5 are actually WEF,
DF.
DF, and I hope Dr. Schwab will not be angry at us.
We'll find out, won't we?
And
Well, thank you
I
so
have
much for
another
taking the
request.
time.
I have
And
another request. She told you that you have a big following, millions.
yes.
And I hope you will tag me and get some of your following and transfer them to me.
Guys, you heard that. Let's follow the WHO. Let's donate to the WHO. They need our funding more than they have ever needed. These are the people on the front lines, Dr. Maria, Dr. Tedros. I can't thank you enough for taking the time and answering these questions for, people like me who are ignorant of everything that you know. But WEFDF, we will remember this. And thank you. And I hope that we pass through this faster, we flatten the curve faster, and everyone is responsible. And I hope that it doesn't take extremely long for us to be able to get through the coronavirus. So, one last question. What does the WHO need from us?
We need 2 things. 1, I know people are worried. I know people are concerned, and they're right to be concerned and worried. Maria had said it already. But what we say is we need strength, unity, courage, and we need to fight like hell to kick Corona out. We have the means to do it.
Yes.
So we should really believe in ourselves. The human spirit is very, very strong. And when united, especially, we can achieve what we want. That's kicking the virus out. So, of course, we should be worried. Of course, we should be concerned. But we need courage, strength, and fight it out. And we should not be, lose hope. We have all the means to kick this virus out. So that's our message. And the second request is, we have the Solidarity Fund.
Mm-hmm.
And Global Citizen Hugh Evans is helping. This is something we started with UN Foundation and the Swiss Philanthropy Organization. And in just 1 week, we were able to mobilize more than $70 million US. This is big.
Wow.
In just 1 week. And
wow.
We would still ask, all your funds and others to contribute to the fund, because it's the solidarity that can help us to kick this virus
Well,
out.
you heard Dr. Tedros, guys. The Solidarity Fund, we've already donated. Global Citizen is taking a big part in it. And it'll just take so much from you guys. Just listen to what Dr. Tedros said and Dr. Maria said is WEF.
DF. DF.
WEF, DF.
F5.
We got it. The Solidarity Fund, and thank you so much, and thank you for doing the work that you're doing. Thank you to everyone out there who are on the front lines doing this for us. And let's do what we can do, you guys. Let's make sure we stay home, be aware of ourselves, practice what we need to do in terms of sanitizing, in terms of hand washing, and keeping a little bit of physical distance from people. I can't tell you how grateful I am to both of you for taking this time, and to all of you, almost 45,000 people who are watching this live. Thank you so much. And a namaste.
Thank you. Namaste. The fight is everybody's business. That's exactly what you said, and I fully agree. We fully agree.
Thank you so much. Thank you. Thank you, guys. Thank you, everyone. Thank you. Bye.
Thank you. Bye-bye. Namaste.
Namaste.